Good evening and Assalamu alaikum. This is Dr. Shanila Asad, your mentor. So today we just arranged this little Zoom meeting just to give you some moral support as your examination is about, there are only 48 hours and we are here just to give you a little bit of, to address all your concerns. So before I start, I want to give you some intro about the MRCPCH and what you have to expect after, when you will be in the examination center. Before I proceed, am I audible? Can please anyone acknowledge me? Can anyone? Hello.
Yes, you are audible, madam.
Thank you very much.
You were audible.
So let me see how many candidates are here. Actually, there, okay. So there are more than 13 candidates. So I welcome all of you. As you know that it's a big movement coming so far up till here, clearing your FOP, your tasks, and AKP itself is a big achievement. And at this moment, I know exactly how you people are feeling. A little bit of excitement and nervousness and kind of little bit of fear. It's actually, I think it's a normal feeling. I exactly know, how you people must be feeling at the moment. But let me remind you that, you have come so far up till now. So itself, it's a big achievement. You just have to tap yourself on your shoulders. You have achieved so far, and I'm sure on the exam day, you all gonna ace your, whatever your preparation. Just believe in yourself. You will ace your exams, inshallah. So before I start, before I take your questions, let me tell you that at what thing you need to focus on the final hours of the exam. Your mindsets is everything. When you enter in the exam, you just have to believe in yourself, right? You have to, enter in the room with your clear mindset. You have to tell yourself that I'm here not just to impress the examiner. I'm here to express my training, how safe doctor I am, and how structured my approach is. So don't think that you need to be perfect on the exam day. Just think you need to be safe, you need to be sensible, and your approach should be focused. The first impression really matters. So the thing is that just remember the 5 seconds rule. When you enter in the exam, be yourself. You just have to be sure that you are confident enough that examiner can see that this candidate has, is entered with a clear mindset that he needs to, he or she wants to clear the exams. You just have to, greet politely to the examiner, to the attendant, to the role player. You just, wash your hand or some, you just have to act like that you are, you are a safe doctor. And always be gentle and kind to the role player and to the, the child that you are dealing with. The exam, at the moment you entered in a room, with the your body language really matters, The examiner himself, when you enter in the room with your confidence and your body language, will tell the examiner that he's the candidate. He just, here to ace the exam. So be yourself, be confident, and the more important thing is your structured approach. So this exam is, you don't have to overthink. You just have to believe on yourself. Whatever you're doing in your daily, I still remember when I entered for my examination day, the moderator who was, they just approach, and the one advice that I still remember, he said, just whatever you are doing in your daily clinic setting, you just have to stick to that. You don't have to, overthink that I will do this and that. Just be with your practice. I know you have done so many practice. You have done the practice of so many scenarios, the history station, the communication. So whatever you say, whatever you do on your exam day, be confident, be structured, and your communication will, is a major role. Your communication, your body language has a major role on your what you are, the examiner will, judge. He will get the idea that what you are up to. Don't, whatever your clinical findings, be structured to that, whatever you said. And the one more important, the most important thing in the examination day, that if any, as a human, some stations goes very good and some stations goes, we don't know about that. But don't let yourself to be, that if one station go bad, don't feel bad about this. Just go with the flow. You don't have to, think about that station. I still remember then when there was my exam, my one station goes very bad, and that was my first station. And I still remember that, I don't know, the next station came and the third station came. I never think about the first station. And finally, the result came, and I just aced the exam. So you just have to believe on yourself. You don't have to carry your, the stress of that one particular station to the other station. To every station, you have to give the fresh start. Every top scorer, I believe that, one or two below average stations, it must not affect your overall performance that you are, doing on your examination day. And your goal should be that, you should be as, whatever you are talking, it makes sense. If you are talking about any clinical findings, if you are talking about, let's say, if the exam, if there's a child who came with a Down syndrome and your command is to do the general physical examination, so be structured. You have to look for the, his head size. You have to look for his associated finding about the murmurs, though it's the, the command is the general physical examination. But you need to be structured, that the examiner is watching you, that what's going on in your brain, right? Are you thinking about the other findings, the associated finding? Are you thinking about any associated, cardiac findings? So this is all. Are you thinking about any, floppiness in the child? So this all should be structured. So far, I think these are all things that really matters. And the very important thing that you need to remember, I hope I'm audible so far. I'm speaking in one tone and I don't know. Am I audible?
Yes, you are audible.
Yeah. Okay. So the very important thing is a day before exam, what you need to do, you know. So I would suggest you to all the, are you all are the, I hope you all are the book, your examiner, you after 48 hours, there will be your exam. So do not study a day before. I think you should take a plenty of rest and just sleep well, get yourself well hydrated. Many of the students have, they have an issue with the palpitations, and uh, I know when there was my exam, many of my colleagues suggest me that I should take a, propranolol 10 mg. But don't do such experiments. If you have already taken, any these kind of medication, then you otherwise take. Otherwise, there's no need to do any new thing on your examination day. You just have to pack your bag early and put all documents, compile all your belongings. You don't have to carry anything else other than your stethoscope. Everything will be provided on the day of the examination. You don't have to wear any lab coats. You don't have to wear any, take any, though you can carry your wristwatch, but you can't wear on your wrist, right? So only the stethoscope, and you just have to carry yourself. That's it. And the most important thing is, you just have to pray to your creator that he knows that up till so far, your preparation is well known to him. So believe on yourself and trust on him. His plans are the best plans, and are all, the prayers from the MedPrep online mentors, and we are here to support you. So any questions you want to ask, we are here to address all your concerns and queries. So one by one, I can take a question if anyone wants to ask anything. So I'm happy to answer those. Hello. Hello.
Yes, we can hear you.
So any question you want to have? Anyone? You all are well prepared. Our best wishes are for you. But anything regarding any, exam you want to ask about on the examination day?
Hi, Dr. Asad. I would like to ask something. Could you give to us any advice by your experience from the exam, like station by station, on what to pay special attention in, like communication or in history or in like our attention, no guided by materials, but like what we to pay attention, especially in every station. Thank you.
So that's a very good question. Your good name is?
Tatiana.
Takyan. Okay. So when you entered in the exam, there obviously the moderator will guide you that how the station wise approach, and there are the 10 stations, right? So on the first station, they will give you the list in which there's a scheme written over regarding your station, which station will you go first, and there's a numbering over that station. So let's say if your station is clinical, you enter in the room, there's a small tray. When you enter in the room, you just have to greet the examiner. There will be a the real patient, and definitely the attendant. There will be a small tray in which there's a hammer, there's a mask, there's a sanitizer, all things are lying in the rooms. So you just have to be listen carefully. You don't have to you have to listen to the examiner, what command he's giving you. So listen the command carefully. Whatever he gives you the command, you just have to obey. Let's say if he give you the command regarding this is a 4-year-old child and you need to assess his cardiovascular examination. So if you are confused, you can always ask the examiner, you want me to start with the whole examination, or you only want me to start with the, the examination of the chest, or only the CVS, that is the heart palpation, and that. They are so much cooperative. They will tell you each and everything. So be yourself, be structured, and start with whatever the command is that there. Then the video station, the moderator are so well, they will guide you about each and everything that, whatever they are systematically, the station wise, everything is so smoothly, done that I don't think so you feel any problem. Once you are in the circuit, you won't feel anything, so that's how this approach, the station wise, you will go inside and you will feel that. Hello.
Thank you so much. Thank you so much. I would like to ask you, like when you were in the exam,
Mm-hmm.
what did you feel in some of the station like, oh, I would like to have this advice, or I would like to pay attention on this, especially? Did you have some feeling, some question about, in
I can
yourself
understand how you
during the
must.
exam? Mm-hmm.
So when you enter in this exam, you just have to be confident, right? You just have to listen carefully regarding the whatever the command is giving to you. There are some station, like in the history station, you will read the whole scenario. When I was appearing for the exam, there was a scenario, and at the end there was a written, please turn over. And I just, because of the exam stress, I couldn't read that. Please turn over. So when I entered in the exam room, the examiner asked me, have you read the second page? So I told her, no, I haven't read I just read the first scenario command. So she said there's some investigation written over the second page. So I really get confused over that time, So these are the small things that read carefully from started till the end. Don't get yourself stressed. The examiner are very nice. They are there to help you in every, they know that, through how much preparation we have come so far. So they will there to guide you each and everything. Even though I told her that I haven't read that, please turn over. So she go outside. She bring that, the scenario sheet inside, and she said, can you please read it again? Then I read that scenario again, and I just start my history taking, and it all goes well. And after that, there's a video station. In video station, we just heard that, we just have to go inside the room and there will be a video. But in our exam, there will be a scenario written over that, the information sheet. So you don't know. Either they give you the scenario, or either they just have to sit 3 minutes outside the exam. You go inside the exam, and then the examiner will give you the command. So it's all depend on the examination day, that what kind of, at the information sheet, what kind of command you will get on that day. And the development station, regarding the development station, there's again an information sheet. Outside the room, you have to wait for 4 minutes. When you enter in the room, they will provide, there's a role player, and the 4 minutes will be this your preparation time. So you just have to prepare about whether they ask for the gross motor, whether they ask for the fine motor. You just have to prepare according to that. And when you enter, there's a role player. You just have to take the history of the role player. And at that, your body language and how you are taking the history is really matter, At that moment, examiner really decide, that are you the candidate who are here to ace the exam, or so after that, it's all depend on, this exam is a very examiner dependent and your luck dependent. I will also say, obviously your preparations really matter. But the thing is that when I went to the examiner, in the development station, the examiner didn't ask me to assess. He just asked me some kind of viva kind of question that at what age the child will do this. My command was the gross motor. So he didn't ask me to assess the child. He just said, can you please tell me at what age the child will transfer the object, at what age the child will stand. And so it's a sort of, uh, viva kind of station. Though we have practiced so far that we have to, assess the child, we have to do this and that, we have to enter the room, we
Yeah,
have to put the
yeah.
hand.
And they ask you just milestones, like tell me when this milestone happened,
Yes,
and
and
that's.
so, so I was,
Mhm.
a little bit confused at what's happening. But the whole thing, I asked him, do I have to assess? I have to, assess the child. He said, just hold. Just give me the answers of what I'm asking. So he take all viva that at what age child will do this and at what age child will do that. And believe me, I got full marks in that station. So it's all your luck and all depend upon the examiner, what he wants to listen. So, but from your side, your preparation, I'm sure that you all must be, the well-prepared doctors. And up till now, you have done many scenarios and many practices. So the one thing that you need to understand is just believe yourself. And now regarding the communication station. Again, what you need to do, there's an outline. They will give you the information sheet. The communication scenario is written over that sheet. And you just have to read it carefully that what actually the examiner wants to communicate regarding what points. So when you entered in the room, you just have to greet the examiner, the role player, and whatever the command is given, you just start with the, the repo building, the introduction, the settings. So it's all depend upon whether the communication is regarding the ethics, regarding the information giving, is the breaking bad news. And I'm sure that you all are well aware that with which communication scenario we have to talk what. So this is how this exams. So that's why I always say, always pray hard, and whatever you do, just do your best and leave rest on your creator. Inshallah, he will handle. And this is all about, uh, how, confident and your body language, how you are, addressing taking the questions of the examiner. This is all really matters. So I hope this is, so far you got the points what I've cleared up till now.
Yes, thank you so much. It's very helpful for us. Uh, and we are nervous. So, do we
No, no,
need like
this is Mhm.
Mhm. Yes, please.
Yeah, actually, this is a completely, I can understand the feeling, 2 days, the countdown is really, now the clock is running fast. And I really, feel that feeling that how you must be feeling at the moment. But believe yourself, right? You have done very well. You just have to be confident. And I hope on the exam day, you will do your best,
Just,
inshallah.
just God help.
Yeah, yeah.
Um, eh, can I ask about history? So we have there like million questions to ask.
Mhm.
Is it necessary to ask all of them if you have no time, or if the role player is talking too much, so you can't finish all the questions, or they pay attention more about how you communicate than to put all the questions on the table.
When regarding the history station, it's all depend upon what kind of history you have take. For the history station, there will be 4 minutes outside the station. When you enter in the room, you will be with the role player, and initial 9 minutes you will be taking all the history concerns. Always start with the open-ended questions. Try to be more focused with the broader aspect. If the child is having fever, then you just have to be focused regarding everything, association, why the fever is, association of the fever. If there's a pain, we have been taking history for long, since the starting of our medical career, we know how to take the history. But I know at the exam point, we all get stressed out. So you have done so much practice up till now. I know that it really requires lots of practice, lots of scenarios every day. So be yourself. Just think that whatever I'm doing in my daily practice, I have to take the history like that. You don't have to overthink about it. If you overthink, you will get confused. You just have to focus what you are going on the right direction. Just believe yourself. And eventually, my history was regarding some, a child with a concern with a non-accidental injury or the vitamin K thing. So, and in fact, we haven't done any practice scenario for that station. But on the exam day, we reached the diagnosis, because once you start with the taking history, the role player will take you on that side and you will reach on it on your own. So believe yourself. Once you start with the history, and definitely you will reach up to the diagnosis.
Okay. Yeah, that's perfect. And so when examiner ask you about NAI, did he wanted strict strict diagnosis or more differentials and management?
So this is again a good question. So examiner is more interested in your approach, that how sensibly you are asking the questions regarding the, whatever your command is. That either you are excluding everything. If there's a history of, let's say, if there's a history of the child is having a joint pain, then you should exclude everything regarding the joint pain. You have to exclude that, any infections. You have to exclude any, is there any bleeding disorder if he's having any, even though the hemarthrosis doesn't have any pain. Is there any, the association with the IBS? So he's looking for your approach, that are you excluding everything regarding that? And once you reach to that diagnosis, then according to the differentials, you have to investigate accordingly, because he's reading your mindset, that are you thinking about these differentials? He's more interested if your differentials are, let's say, with the joint pain, you have you asked about any, regarding the involvement, have you asked about the eye symptoms? Have you asked about any heart symptoms, that if the joint, have you excluded rheumatic or IBS? So he wants to see that you are covering all the areas in which there's a possibility of joint pain. And then according to that differential, you are putting all those investigation one by one. So it's not that you have to be specific or perfect about that diagnosis. He's not interested in the diagnosis. He's more interested how you approaching that case. Are you getting me?
Yes, yes, this was perfect. This just clear my dilemma.
Yes.
Because like that, actually, he is testing all your knowledge, not just
Exactly.
like arthritis,
No,
not
no, no.
just
It's
like
yes.
endocarditis or whatever, but all
Yes.
knowledge about the topic. Yes.
Yes. So he needs to know that if there's a Down syndrome, he needs to know if you are concerned about any, his floppiness, if you are concerned about any heart murmur, if you're concerned about any air discharge, if you're asking about the history of any duodenal atresia at the time of birth. So he's more interested in that you are touching every part of that area. So this is basically a exam of your approach, that the knowledge part you have already given in your FOP, AKP, and TAS, right? He knows that your knowledge is perfect. That's why you have come so far till the, having the seat of clinical itself is a big achievement. So now the examiner wants to see how safe and structured doctor you are, how safely you handle the child. He don't want to listen any fancy diagnosis, any rare diagnosis. He wants to listen that are you approaching that if the child is having a murmur, and he wants to know, okay, are you aware about that which murmur is significant for what? If it's the upper sternal edge, you are thinking about the pulmonary flow murmur or the pulmonary stenosis. If there's a lower left sternal edge, are you thinking about the VSD? He's more interested in that. He don't want that specific diagnosis. Is it clear so far? Hello.
Yes, perfect. Thank you so
Yeah.
much. Perfect.
So this is how, and when is your exam, Tanjina?
Yes. Dr. Asad, can I just add on something also?
Yeah, sure, Jilda.
Because I attended last time in UK. I failed although, but I would just like to tell like those who are appearing, no, it is like because we are nervous, we will forget the basic things also. So be cool. That is the main thing actually, as you told. And then the approach to the kids also matter because in my station I got a 12-year-old child who had multiple scars like medial sternotomy, lateral thoracotomy scar also, and everywhere there was murmur. So I was totally confused also. So when I told like initially pulmonary stenosis, then I changed to aortic stenosis. So like all like it was so much half a sudden. But then I thought like I will not get anything. But the thing I did, like I felt like it was a 12-year-old girl. She had like developing breast and all. So I felt like already when I entered the room, she was exposed upper part. So I felt like she is not comfortable. So I just asked her, "Do you want to wear the blouse?" So the mother told it's okay, it's okay. But when they asked child, she told yes. So then after I had a quick look and then I let her wear that one. So I think that mattered. Like examiner might have felt the approach, no. So although I missed the one thoracotomy scar, in the when I get the feedback, I got 7 in that station. So it was mentioned like lateral thoracotomy I missed. That is all. Nothing else she mentioned in that one. So I think although like everything structure, everything was bad, the approach, like I felt some empathy towards girl. Maybe that mattered. I think. Also in my second
Yes.
station, yeah. Yes. So also in my second station, it was like respiratory. Smart kid, I don't know. Like I mean, actually, I was not well prepared that time. So I just felt like normally how you do, and I did not find anything. So I just told it is normal. And he was the examiner, and you have seen in the YouTube videos and all. And he told, see, he got a trick for you, and he was making some like normal silly trick. But I told, yeah, very good, high five. I gave him, and then the question he asked was what you will give for him normally like that. But I forgot to mention like vaccination. So that was what he wanted. So in that station also, although I was half a sad, I got 6 in the clinic. Yeah? He mentioned you should give vaccination. It was double aortic arch something. In the feedback he mentioned dual aortic arch was the diagnosis, but nothing mentioned regarding that, and I got 6. Like chest was clear like that. So main thing is like we should be like the way we deal with the kid, it will matter in even in UK. I was very much worried in the clinical because we have to face the kids personally, so I was too much worried actually. But after this, I felt like clinical is somewhat okay. Like when how you deal with the kid, it will be fine only, nothing to worry about. Also in the third station, actually, it was a 3-year-old kid with portal hypertension, fully jaundiced, full ascites, and also I felt so sorry, so I couldn't ask anything. I was feeling for the kid. So basically, I got nervous also, like what to do. So in that station, even the minor thing also, he asked like what is the complication of portal hypertension. So esophageal varices, although he had NGT, I couldn't tell, but they will prompt you, like they will finally I told, so they will help you only how to reach that. So if you are clear in my mind and if you are very cool, then you will remember things, otherwise you will be nervous. So that is, I just wanted to share my experience so that you will feel.
That's a really helpful input, Dr. Jilda. It's really helpful for all the candidates. So this is this is what exactly the message is, that in this exam, the examiner wants to see how safe doctor you are. He don't want to listen for the fancy theories that this is a very rare diagnosis. You are he just want to see how polite, how safe, how structured your approach is. How the in the history he wants to see that you are covering all the areas if according to the symptoms. In the communication, he wants to see about your empathy, about your how polite you are with the attendant, and how structured your explanation to the role player is. Again, in the video station, they wants to see sometimes, in when I was appearing in the exam, the station was saying there's an audio and you have to listen that audio, and they will give you some rare finding that there's a auscultation, the percussion sounds are going on. They wants to see either you wants to differentiate between the dull percussion or the that normal percussion or stony dull. So these are it's all depend upon your definitely your luck, and again what the examiner wants to listen. So that's why I said this is more about the examiner dependent and how your approach is. Want that, just believe on yourself. Just believe
One
that
more thing
whatever
I will
you.
add, Dr. Asad. Sorry.
Mhm. Yes.
Actually, in my another station, it was motor examination of the motor examination. The child was in wheelchair actually. So when I examined initially, I felt like it is hypotonia, but there was contractures. So I was little bit confused. But then when I was presenting, I told like hypotonia. So the examiner asked me, "Is it hypotonia?" Then I got confused. I told no, hypertonia. Then in the finding like feedback, it was it was hypertonia. You mentioned hypertonia. It was myopathy. So you should believe in yourself and tell what you felt only. Don't manipulate according to some examiners. That was.
Exactly. Just believe on yourself that whatever you have seen, it's don't confuse with yourself with what the examiner are giving you there. Is it that? Is it that? So whatever you feel that this could be this, just go with that. You don't have to get yourself confused. I know this is a very, at on the day of the exam, everyone feel nervous and stressed, but pray hard that, you have done so far, you have achieved the clinical seat. This is itself is a big achievement. So, whatever your approach is, just believe on yourself. This is the key message of this today's, that when you enter into the exam, just believe on yourself that whatever practice you are doing so far in the centers, you will apply those practice on that examination date. You don't have to overthink. You don't have to think too much. If you think too much, then you will lost the track. Then that you have multiple diagnoses in your mind. Just be simple, just be structured. Whatever comes in your mind, whatever the differentials are according to the history, you just have to quote those differentials on the examiner. And now again, the questions to of the examiner are very simple. They want to listen the differential, they want to listen the investigation, and they want to listen the management. So again, the differentials, you have to investigate according to those differentials, and then again, you have to give your management plan according to that differential, right? So if you, let's say if any history in which your differential is non-accidental injury and your differential is vitamin K, then you obviously have to involve the multidisciplinary team. This multidisciplinary team word is a very, I must say the favorite word for the examiner. They want to listen that. If in any case, you have to quote this word, that multidisciplinary approach. That they really want to listen that word according to your differentials, and so this is a very helpful word. So anything else anybody wants to ask? So let me see who is.
I missed the first 15-20 minutes of your talk. If you could just summarize in a couple of lines, it would be great.
So I just, initially I just talk about that regarding how this exam is all about how safe doctor you are, is all about your approach. Up till so far, you have done practice of so many scenarios. I know that you all must have done so many practices, the scenarios like of many scenarios, your communication station, your history station, your development station. So to summarize all what I've talked so far is that this exam is more about your approach. It's also depend upon the examiner, what examiner wants to listen. And obviously, the examiner is the key person, and it's all depend at what point he seems to be satisfied regarding whatever you said about your differentials or your investigation. So it's more likely also examiner dependent exam. And the one thing you need to make sure that you don't have to think too much about the differentials. Keep your differentials simple. Common thing first. Don't think rare diseases in the exam. The examiner is there only to see your approach, that how sensibly you are approaching the child. You FOP, AKP, TAS is all about your theory. And he know that up till now you have cleared all three. So your theory is strong. The examiner know that. He wants to see how that theory you apply clinically on the patients. He wants to see how good you are practicing in your routine clinics or your routine daily work. So this is the exam to assess how safe doctor you are. Again, there's a 10th station. You all are aware about those stations. When you enter in the exam, there's a registration desk. They will register you, and they will give you some there's an envelope, and in envelope there are 10 mark sheets. You just have to fill those mark sheet with your roll numbers, and then there's a scheme over that circuit given to you, that what number of circuit you have to enter first. And you just have to go in that circuit station, and when the bell ring, there will be a 4 minutes preparatory time in each station. And after that, the next bell ring, and you have to enter the room. And accordingly, depending upon which station you enter, it's about whether it's about the history station, communication station, video station, or the clinical station. So initial 5 minutes are very important, right? Your body language, your confidence, your listening, what the examiner is saying to you. You must, properly listen the command, what he's saying. And then the greeting to the patient, the parent, and the examiner. It's all, the initial 5 seconds are very important. And I always tell that believe on yourself, right? Be confident. Enter like that, you are a safe doctor. Your training is that much. You must be confident on your training that today definitely I'm gonna ace this. So whatever the command is, listen properly, approach the child. The examiner wants to see your structured approach, that if the history is any, let's say if he giving you any history about the fever or any joint pain or about any heart issue or any concern regarding the non-accidental issue, injuries. So he wants to listen that you are touching every part of the, excluding the every important nose and going toward the positive finding. So this is how this exams, proceed. And I hope that the one important thing is that believe on yourself, that up till so far you have done so many practice. I know that all must be how it feels then before examination day. Approximately most of us, practice 8 hours daily and give your best on the exam day and leave rest on your creator. That's the message of the day. Is it clear for so far? Dr. Chaudhary, right?
Yes, thank you.
Yeah, you're welcome, Dr.
Thank you.
Chaudhary.
Well, helpful.
So I think if anyone wants to ask anything regarding any, that your, how regarding your clothing, there's no, as you know, the lab coats are not necessary. You don't have to, you just have to formal clothing, be decent and formal clothing. And there shouldn't be jeans or like, there's all decent, your clothing. And this is only the stethoscope you have to take. You have to carry your wristwatch, but you don't have to wear on your wrist. You just have to carry on your pockets, or that's it. And everything will be provided there. You just have to carry your stethoscope. So on the behalf of MedPrep Online team, we wish you all the best of luck. So again, I will, tell you that before the exam day, don't study till the last minute. Just take plenty of rest, and stay well hydrated, and take a good amount of sleep, and start your day with the prayers, and just believe on yourself.
Thank you so much, Dr. Asad.
You're welcome. So best of luck to all of you. And inshallah, you all will ace your exam.
Thank you so much.
Okay, welcome.
Thank you so much.
Okay, Hafiz. So I'm signing out. Hafiz.